Until recently in the UK, keyhole surgery was only used for relatively straightforward procedures like hernia repairs, gallbladder removals and appendectomies. The Harley Street Clinic, part of the HCA group of hospitals in London, is helping pioneer its use in heart surgery. Mr. Inderpal Birdie leads the specialist keyhole heart surgery team at the Harley Street Clinic and also at his NHS practice in Essex.
In the UK it's very new. There are very few centres doing any large volume of keyhole heart surgery. But of course in Europe and in the US for the last decade there have been a number of units performing surgery of this type with very good results.
One of the recent beneficiaries of this procedure is Felicity Young, who had been living with the symptoms of a damaged mitral valve, one of the 4 valves in the heart, for some years.
I think probably the first difficulty is that I noticed that I was getting increased breathlessness. And then my husband actually discovered that I'd got a murmur because he listened to, being an ex-GP, he listened to my chest because I had a really severe cold. And then I was referred to the cardiac specialist in Colchester, who after some tests said that I'd got a severe prolapsed mitral valve with a moderate leak.
Mrs. Young was referred to Mr. Birdie as a possible candidate for keyhole heart surgery to repair the damaged valve.
So here is an echocardiogram of Mrs. Young's heart pre-operatively, and we see the very powerful left ventricle that pumps blood around the body and the smaller, less powerful left atrium into which blood from the lungs arrives. Here is her mitral valve. This valve normally opens in one direction and closes when the ventricle contracts to prevent blood from travelling back towards the lungs through the left atrium. Now if we are to put some special colour flow on here to look at where that blood is flowing, we see that when the ventricle contracts we have a huge amount of colour going backwards. That represents blood leaking back through the valve towards the left atrium and towards the lungs.
Mr. Birdie very clearly explained that the options are either conventional surgery, heart surgery, which involved cutting down through the sternum, or because his speciality is keyhole surgery, that's what he also offered. And it was up to the patient, up to me, to choose which I would like, and he would, even if at the last minute I changed my mind, he would respect that. And I chose to have keyhole surgery.
Your GP sent you to me because he's recognised that you have a...
For Mr. Birdie's younger patients, the minimal scarring associated with keyhole surgery is a particularly attractive benefit. For all patients, the incision heals much more quickly than cutting through the bone, 10 days on average, rather than 12 weeks. It's been just over 2 months since Mrs. Young had keyhole surgery, and Mr. Birdie has been following her progress.
And here we have the post-operative echocardiogram, and here we have the mitral valve. You see the normal anterior door or leaflet that was always working normally, and we see now it meets perfectly the posterior leaflet, and there is no high riding or prolapse of that leaflet into the left atrium. So a very good result.
For Mrs. Young's husband, a retired GP, the speed of her recovery has been remarkable.
I just find it truthfully miraculous that she should have surgery one afternoon and then a few days later she's walking home or walking to the car. No, it's staggering. I just cannot even now get over it. Even being in the game, I still find it miraculous.
She's gardening now, she's mobilising well, she's taking walks regularly, and I expect that over the course of the next few weeks she will recover so much more of her previous exercise capacity, the sort of things that she couldn't do before her surgery.
Repairing the mitral valve is only one of the keyhole heart surgery procedures that the team perform. They also treat patients with heart rhythm disorders, coronary artery disease and aortic valve disease, both at Mr. Birdie's NHS practice and at the Harley Street Clinic.
The Harley Street Clinic has an international reputation, and it deserves that international reputation. I think the clinical governance process that are associated with introducing new techniques like minimally invasive cardiac surgery are exactly how I would wish them to be.
I would definitely recommend it, and indeed I have with 2 people who I've met who have got valve problems, that if they get given the option of either the conventional way or the keyhole surgery, if they're suitable to go for the keyhole surgery, because of the recovery time is so much quicker and less discomfort.
I still, as I say, I'm astounded by the recovery time, which is so small, that Fist is almost back to normal, and in such a short time. No, it's terrific.